So I'm going to talk about the co-creation of virtual reality reusable resource for European healthcare education project. This project is an Erasmus Plus strategic partnership that started back in November 2018 and will finish this year. And there are three main partners: University of Nottingham, Aristotle University of Thessaloniki, and science institutes, REUSABLE called at the time of the application, together with some associate partners, University of Cyprus, University of Leeds, and Silver Sky 3D. But usually it's not one-man show or just three institutions. There are a lot of people that have worked for this project, and probably I have forgot some of them, so apologies in advance. But we should acknowledge every small piece of work in this project. So how we started? So in University of Nottingham, we do a lot of recordings for reusable learning object resources, which is web-based resources. And we thought, can we go a little bit further? That was pre-COVID, pre-pandemic. And we found out that we have the Engage system, which is a recording system, a virtual lecture recording system, which back in 2017, when we were discussing, seems to be quite a good thing for a lecture or something. And then we said, okay, but we need something a little bit more innovative. This is like somebody's recording a presentation, or you can see someone. And we found out that we have a tracking system that when somebody uses around the room, they can track them. So we can accommodate some group teaching that the lecturer can go from table to table. But again, we were missing something. And we thought, okay, how about 360 videos? There are quite a few out there. So we bought a cardboard and our mobile phone, and we started doing some roller coaster or being near bears, and we were quite excited. And we tried to find what out there about healthcare or medical applications, and we found out that there are not a lot. There was some initial resources, like the first 360 video resource of surgery and something of the lab, but still, I mean, there were very basic things, and most of them were proprietary. And we thought, why not giving the control back to the user and try to create some kind of resources? And we tried to play around with a 360 camera and in small facilitated sessions, and try to see the world through the eyes of a student. And actually, our students liked the idea. So we started to thinking how virtual reality and 360 videos can help us, and we came with the idea that it can be used in small groups, tutorials, hands-on session, clinical skills, maybe virtual reality reusable resources that can be reused, so they can be small and reused across many contexts. So why CoViRR, why now? Clinical skills labs exist in many universities and university hospitals, having a high maintenance cost and doesn't always offer to the medical and nursing students a fully immersive experience. In recent years, there is an expansion of ICT in healthcare education, and a number of online resources in the form of reusable learning objects, virtual patients, and other on-screen computer or mobile simulation tools have been created with positive acceptance by the students. But the current efforts lack to provide a cost-effective and immersive clinical skills learning experience. And in addition to that, virtual reality exists for many years, but it is only lately that the new generation of smartphones can make VR accessible to a wider audience. And there are a few examples of VR resources for healthcare education, but some studies already have shown some promising results. While simulation-based training is identified as a valid teaching learning strategy, at the same time we have little evidence for the design and use of virtual reality reusable resources in healthcare education. So the we didn't manage to find any development framework at the time for the creation of virtual reality reusable resources, utilizing also the stakeholders' participation. So having said that, we combined the expertise of the three partners, and we said that we need to do an analysis of where we can implement virtual reality reusable resources into healthcare curriculum. We needed to have a participatory design. We wanted to have an analysis of effective problem solving in order to be able to design such kind of resources. We thought that we should organize some training students event, and maybe we can identify how they should be implemented in practice in terms of pedagogical aspects through a modified Delphi study. So we end up with, on the right side of your screens, with this list of outputs for this project. So those are the detailed objectives of CoViRR, but I will move to the target users because I believe this is more important. So we wanted our healthcare students to be able to practice in multiple situations, in different contexts, without the need to be there in order to reduce the cost and give them more opportunities. So CoViRR, we feel that address these needs. At the same time, the healthcare teachers, content creators, and policymakers will benefit because they will have on their hand new pedagogies and innovative technologies. Healthcare workforce, as part of their continuous professional development, can always benefit of such kind of resources. And the group which is usually forgotten, which is learning technologists, they will have on their hands tools and ways to develop such kind of resources. So the first thing that we decided to do was to create a train the trainers curriculum and deliver training to the wider team in the three institutions that participate, including with University of Cyprus, in order to be able to develop some resources. But there was no such curriculum available anywhere. So what we did is we search the literature and then we draw on partners' expertise, and we combine those two in order to develop such curriculum. What was the result? The first thing that we tried to identify which are the target audience. So as a target audience on this Train the Trainers event, we had experts on the topic, we have online pedagogists, and we had learning technologists. So those are usually the people that are come together and develop the resources. So we developed this curriculum, and at the same time we had target learners and contributors from multiple categories because we wanted to make it condensed in 3 days and address the needs of all participants. We had to blend both the contributors and the learning objectives. So we did the training and we evaluated with 23 participants with an average 10, almost 11 years of experience in the balance between male and female. And we found that this training improved the confidence in using co-creation approach to develop digital education resources. And in the self-statements of participants in pre and post evaluation, they increased their understanding on co-creation methods. And the same thing came as output for the virtual reality, the developing and designing of virtual reality resources. Again, with a self-statement pre and post, they show that their current knowledge, understanding, and designing and developing virtual reality resources have been increased. Of course, we had some challenges on doing that. The biggest challenge is that we had to draw on our experience because that was there was very limited resources out there. So the next thing is, okay, now we train the trainers, and how about the curriculum? How we can digitalize the curriculum and implement such resources? So we aim to identify the potential role of virtual reality resources into the current curriculum. So we want to identify and find consensus and ensure the quality of virtual reality themes and scenarios that could be implemented in healthcare curricula and provide an innovative new healthcare curriculum. We wanted to increase understanding and awareness of use of digital immersive resources in healthcare curriculum. So what we did, initially we outlined learning outcomes from partner healthcare institutions that describe the main learning outcome from all medical institutions of CoViRR Consortium. The next step was the learning outcomes expert evaluation that includes the methods and the results of the consensus finding process for the integrated clinical skills curriculum learning outcomes. And finally, we developed a healthcare curriculum plan implementing those virtual reality reusable resources that outline the most prevalent learning outcomes in the form of a tentative curriculum plan. So for the aggregated learning outcome list, we prepared a Google questionnaire and we prompt experts to rate the clinical skills according to their opinion regarding the importance of the implementation in virtual reality, augmented reality, or mixed reality with a Likert scale, 1 being the lowest, 5 being the highest. Clinical skills were rated according to responses from the expert. The score was calculated using the formula that you can see, the sum of Likert scale responses multiplied by participants that selected this response. And the second section of the questionnaire asked the participants that you can see on the right side to rate in order of appropriate of 3 immersive modalities, 360 interactive videos, mixed reality, and virtual reality for each learning outcome. A total of 11 participants participated, 6 men and 4 women, and 1 didn't declare gender, with an average age from 31 to 52-year-old, both clinicians and some technical experts. And those are the results. As you can notice, we have the different topics, the learning objectives, and how much they identified each of the categories. I'm not going to go in detail, but based on the responses, we managed to include with yes the learning outcomes that we included into the curriculum, and with tentative or no, the tentative outcomes or the outcomes that we didn't feel that they could be implemented with some kind of virtual reality with a broader term concept. And we resulted in this healthcare curriculum plan, which is available through the CoViRR website, and you can have the chance to read in detail. And that led us to today, which we collocate the CoViRR Multiplier event with May 2021 International Conference. And today and tomorrow, we started with digitalizing healthcare curriculum and a small introduction to CoViRR. And in this session, you are going to hear more about the CoViRR Erasmus project, the lesson learned, and some future activities, and how we combine that with other activities and other projects. It will follow a showcase of virtual reality reusable resources. You will have the chance to download and test them as well. We will tell you how you can co-design a virtual reality reusable resource. We hold a workshop that you can co-design and even try to create one tomorrow. We're going to talk about feasibility and acceptability tools and give some examples of what we did in order to validate those resources. And last but not least, we're going also to tell you some recommendations and how we came up to that recommendation for use the resources that we developed, those similar resources in healthcare curriculum in terms of pedagogical aspects based on experts' opinion from around the world. So initially the CoViRR, we thought that it would be a straight line, but soon we found out that it would have a lot of curves, more than we thought, actually much more than we thought. So the road was very difficult, but since we are here, we believe that we managed to find a solution, and we drove ourselves to this point that we are able to present you those results today and tomorrow. So thank you, and apologies for being a few minutes late, but we tried just to shape the whole 2 days.